Morning, everyone. Dr. Eric, the fitness physician. So today I'm going to show you a step-by-step process on how to balance your hormones, lose unwanted body fat safely and naturally in the next 4 to 6 weeks. So the topic of this short video is myths about hormonal weight gain and about weight gain in general. So this comes up a lot with clients, and when I hear this and read things on social media about weight gain, and of course there's multifactorial, there's a lot of things involved. Of course, it has to do with diet and lifestyle and exercise and stress and many, many other things. But the question or the concern that comes up about is, what about hormones? Hormones are intimately involved in weight gain too, right? Of course they are. They can definitely affect everything. They're just as important. It's not that it's just hormones or it's just calories in, calories out, or diet. It's both, and they're both important. I'll talk about this on future videos too. But some of the biggest myths are that, especially for example, women, as they get older, they go through perimenopause and menopause, that hormonal changes, what happens? How does that affect my weight gain? Or is going on hormones going to affect my weight gain or not? And how is that? And then there's some other myths about estrogen and how that affects weight. A lot of people think that it's going to cause you to gain weight. So I'm going to bust a few of those myths here today and explain how to do that. And of course, the how-to process is very complex, and that'll be the topic of future videos. So number one, one of the myths about hormonal weight gain that I hear a lot, number one, is that hormonal balances can lead to weight gain. Well, it's kind of a trick question, right? Yes, some do need to be modulated, and some hormone levels need to be higher. Some need to be a little bit on the lower side. Again, it's all about balance, right? So typically a hormonal imbalance can lead to weight gain. But again, not all do. For example, thyroid imbalances are extremely important because if it's your thyroid is not acting properly, or it's hypoactive, or is this subpar, or you're not converting a proper thyroid hormones, this can definitely lead to weight gain, right? So this is a very important one. Testosterone, DHEA, growth hormone, these are more anabolic hormones, right? IGF-1. And of course, you want those to be in the optimal range, sometimes on the higher end of that, in order to achieve changes in your body composition, your overall health. So, however, on the flip side, like I did in a video last week, insulin and cortisol, you need those. They're very important, but they need to be modulated. They can be high at the right time, and that will actually serve you well, but you don't want them to be high all the time. So again, it's more about balance. In general, they need to be modulated more in the lower to mid range more than anything else. But again, there are times that they need to be high. And for example, after a workout, you're eating, right? You want insulin to be high because you want to shuttle partition nutrients into your muscles so you can build muscle and burn fat. So again, it's all about balance. Again, estrogen, progesterone, that's another myth too, and I'll talk about that later, but how those can be out of whack to cause weight gain. Again, it's all about balance. So it's not all hormonal imbalances, yes, but again, some need to be higher, some need to be on the lower end. Number two, estrogen dominance. This term is definitely, I hear this a lot, and it just doesn't exist, truthfully. I guess in the true sense of the word, yes, because it can be a dominance per se of estrogen compared to other hormones like progesterone, but it's more of an imbalance. It's not a dominance per se, because most of the time as we get older, especially women and men, our estrogen goes down. So actually, it's not really a dominance, it's just that we lose progesterone, testosterone, and other hormones faster. So it's that seesaw, estrogen on one side, progesterone on the other, and they can get out of balance. But typically, most of the symptoms that people complain about is actually related to insulin resistance. So it's not really estrogen dominance, it's really insulin resistance. Guys, they talk about quote unquote gyno, which is not really gyno, which again I'll talk about later, or with women as they gain weight, or they have those symptoms as they go through perimenopause, menopause. It's actually related to insulin resistance. Women with PCOS is related to insulin resistance. Everybody thinks it's related to estrogen, but it's not. Again, it's both men and women, and again, it's typically low progesterone and higher lower testosterone. And even though the estrogen is a little bit higher than those, the estrogen is actually low too. So again, as we age, insulin resistance tends to get worse, which causes more weight gain and more inflammation. So the process actually gets worse over time, especially with women with PCOS. They don't outlive it or outgrow it. It actually gets worse over time because the estrogen continues to drop, as do all the other hormones. So estrogen dominance doesn't really exist. It's insulin resistance. So that myth needs to die. Myth number three is that menopause always causes weight gain. Well, obviously a lot of women do experience weight gain during menopause, but not all do. And it's more often the result of lifestyle changes rather than hormonal changes. Typically, if anything, it's the opposite, right? As their hormone levels go down, once they were repleted, you actually will improve your weight and body composition. You can actually slow down or stop weight gain and actually lose weight by giving estradiol, by giving some of the other hormones that I talked about earlier. So all women are going to gain weight at menopause, but again, it has to do with more of the aging process. Again, senescent cells, oxidative processes, quote unquote, wear and tear, lifestyle more than anything. stress, etc. And hormones do play a role, but it's not because you're losing hormones that you're gaining weight. If anything, losing the hormones is actually going to accelerate. When they've done a head-to-head studies, women on hormone therapy versus not, and they've compared them, the women who are on hormone therapy actually gain less weight or actually lose weight compared to women who do not. So that myth also needs to die. The next myth is testosterone causes weight gain in women. Testosterone is often associated with muscle gain, especially in men, but also in women, and therefore you can quote unquote gain weight on the scale, but it's usually gaining muscle and not gaining fat. But you're going to see changes in your body composition. You're going to look better in the mirror. Your clothes are going to fit better. And sometimes you can get a little bit of water retention in the first month or two, but typically it goes away. Again, if you're doing it properly, working with a trained clinician who knows what they're doing, this isn't even going to happen. But if it does, it's transient. But again, this happens less commonly with women than with men. But again, this is a myth. It's not going to happen in long term. Yes, you can put on, or at least maintain, maybe put on a little bit of muscle, but in the end, over 6, 12, 18 months or more, you're going to lose fat and you're actually going to look better. So whether your weight changes or not, your body composition is going to be better, your health is going to be better, you're going to look better, and you're going to feel better. And that's the most important thing. Like we tell everybody, it's not about the scale, even with men, because muscle obviously weighs more than fat. So it's about your body composition. So again, this is not true. Next myth, cortisol always causes weight gain. Again, cortisol is often called the stress hormone. I talked a little bit about this last week. So it can be associated with weight gain. How it doesn't always happen. In fact, some cases they actually create weight loss if you harness it at the right time. This is what I was talking about earlier. When you want cortisol spikes, for example, during periods of exercise, you want it because it's actually going to help the fat burning process. But the trick is you want it to go back down to the normal range. You don't want to elevate chronically all the time. Yes, if it's chronically elevated, you're always stressed, you're having some adrenal issues. Yes, over time, it's going to happen and you're going to actually start gaining fat around the midsection. That's what it does. It's like chronically, it's a catabolic hormone. You can lose it muscle and you can start gaining fat in the midsection. But again, it's all about modulation. It's all about timing, just like insulin. The last one is about estrogen causing fat gain. Again, I kind of touched on this in the first one, but actually estradiol leads to fat loss. That has to do with basically muscle maintenance, improved insulin sensitivity, lowered inflammation, improved mood, improvement of your stem cells. And again, you're actually going to burn fat, especially visceral fat, and maintain muscle mass through its action on stem cells and your overall mood and activity and balance than anything else. And it's actually going to improve these factors and help you. And again, it improves insulin sensitivity, which, as I talked about, point number 1 and 2, that it's all about insulin resistance. And this is hyperinsulinemia is the biggest problem. And we're going to improve that by modulating our estradiol levels. So again, that is a myth. So again, remember, weight gain is very complex and influenced again by many factors: diet, lifestyle, exercise, hormones, and much, much, much more. So I want to put some of these myths to rest. And if you want to learn more about this, or you want to work with me one-on-one, reach out to me, DM me below. Go to my website, drericprimex.com or primexweightloss.com. Happy to help you work with this. If you have any questions, reach out. Hope you enjoy this video. Please like it and share it, and reach out to me with any questions. Everyone have a great day. Thanks.